Tonight on 59 Minutes, we will be taking a look at the life of Marlin, a fish suffering from dissociative identity disorder. Now we'll take a look into the troubled life of this poor fish.
I'm just depressed, and I keep forgetting things because I lost my son, and I can't find him. Hi! Hi! I want to swim. I want to play with my toys. I like my toys. Nemo!
Shut up! Shut up!
Nemo, but I love Nemo.
Nemo, stop being a baby! Nemo! You don't even like Nemo!
Nemo! I hate my blood! I need to be buff! Where's my platypus? Hi! Oh, our platypus! Gotta go for a swim. Where am I? Where's Nemo?
Here we have 3 different therapists. Could you each introduce yourselves and explain a little bit about your approach in helping Marlin?
Well, my name is Dr. Johnson, and I take the humanistic approach to treating my patients. I believe that if I just treat Marlin like a friend and give him a comfortable environment where I can just talk to him, I can use active listening to find out what he's really thinking and help him feel comfortable. And I believe that people are responsible for their own growth, and so he can decide if he wants to change, but I should just give him a comfortable environment.
I'm Dr. Swenson, and I believe that Martin has a chemical imbalance in his brain, and he needs drug therapy to get him over his disabilities.
I'm Dr. Nelson, and I use psychoanalysis invented by Freud himself. And I believe that through free association, I can discover resistances and interpret the childhood memories that have been repressed in his mind.
Now let's take a sneak peek into the various therapeutic approaches.
So whenever you feel like speaking, just go and tell me whatever you feel comes to your mind.
I don't know. I don't think I feel like talking today. I had this crazy dream last night, and Nemo was back. But then he wasn't back because he got eaten by a shark. And then I started thinking, what if he never comes back? And then it reminded me of that time when I was little, and my sister ran. Never mind. Anyway, my dream about Nemo, it was just really scary. And I really hope he comes home. I already lost my wife. I don't want to lose Nemo.
You mentioned something about your sister. Could you
I don't want to talk about it. Can you just stop prying? Everybody always pries. You're such a bad therapist. Ugh.
Why do you believe you're so angry towards me?
Where's Platy? Where's Platypus? I need a platypus. What?
Okay. Well, Marlin, I think you might need some drug therapy. But from what I interpreted today, I believe that you have some repressed feelings about your sister. And you have anger towards her.
I kind of miss my old therapist, but things weren't really working out. So she wanted me to come see you. I just don't understand why I'm being affected by this.
It's not you. It's all in your brain. It's chemical imbalances. And we can fix it. Don't worry. We will get through this.
But she already gave me drugs. She gave me drugs that you prescribed to her, my other therapist, to give me before I came here. And they're not working. I just feel tired all the time.
Could you describe to me how the last drugs have affected you? Like, give me some descriptions.
I just don't have much energy anymore. I don't feel like really doing much. I guess my symptoms in terms of changing personalities or whatever you guys claim I'm doing when I black out but I don't know. I just don't feel as happy or sad. I'm just kind of blue all the time.
Do you have as many personality changes as you
I don't know.
normally
I
do?
told you I don't believe that because I just black out. But my neighbors don't want to hang out with me anymore because they say that I don't have any emotion. And when we play Go Fish, it's just really hard.
Alright, well anyways, I'm going to prescribe you this new drug to try. It should be better. And I'm also going to prescribe you to a new doctor that takes a more humanistic approach.
It is gonna get better. Where's Platypus?
Lynn, I hear you were referred to me. Can you please tell me a little bit about what you've been experiencing lately and how it has affected your life?
Well, I was thinking about my past, and I just got kind of depressed. And then, apparently, I have multiple personalities because people keep calling me different names when I'm swimming in the reef. But I never really remember stuff. I just remember blacking out. But my old therapist gave me drugs, but she thought I needed more help, so she sent me to you. And my therapist before that did even more stuff trying to help me think more positively, but that didn't work either. I don't know. Life just seems hopeless, and I miss my son Nemo.
So what you're saying is others are telling you you have a disorder, but you don't really understand what it is.
Yeah, I guess. I kind of believe it because I do end up really weird places sometimes. Like the other day, I ended up at the Great Barrier, and I didn't know how I got there because I was in my anemone like 5 minutes prior to that. And it's like a mile swim. That takes me an hour. And then I was just there. But I don't know. Sometimes I just think I'm forgetful. And at this point, the days always just kind of blend together. So who knows how I got there.
So a lot of times you just show up in weird places and you have no idea how you got there?
Yeah. But the drugs the other therapist lady gave me are kind of helping out a little bit.
What have the drugs helped?
I don't black out as much. And now I only end up in weird places like once a week instead of 5 or 6 times a day. So I guess you can call that an improvement. But I'm kind of melancholy, and my neighbors don't really like how unemotional I am. They don't want to play go fish with me anymore. They think that cards are only for people who are really fun, so I'm not invited. And that's not really helping my depression. It makes me think of Nemo.
It's okay.
Nemo. I just don't know what happened. Shut up! Stop! I just want Nemo. I can't help it. He's my only son. Stop crying. You're better than this. Ugh.
Okay.
Who are you?
Your therapist. Oh. Okay, well, you've clearly made a ton of progress today, but I think you're going to need to come back for a few more sessions so you can help yourself grow and truly understand your feelings, because I believe that with your own personal knowledge and growth, you can get over this disorder and help to come understand what this disorder is truly about. So I'll see you in a few days, okay?
Okay.
Okay, well, you have a good day, all right? Okay.
Thank you for joining us tonight. Hopefully now you all have a better insight on what it's like to live with a psychological disorder. Thank you for joining us, and let's all join the fight to help find Nemo.
Give me therapy.